Just when it appeared that Republican opposition to health reform couldn't go any more mindless or over the top, Republican Congresswoman Virginia Foxx of North Carolina decided to step into the breach. In a jaw-dropping speech on the House floor, Ms. Foxx dragged the Republicans round the bend, from the party of no to the party of oh no.
I believe that the greatest fear that we all should have to our freedom comes from this room, this very room, and what may happen later this week in terms of a tax increase bill masquerading as a health care bill. I believe we have more to fear from the potential of that bill passing than we do from any terrorist right now in any country.
You hear that, Al-Qaeda? You hear that Haqqani network? You hear that nihilist dirtbag terrorist trying to steal nuclear material somewhere in the world right now? If Congresswoman Virginia Foxx had a choice between your worst attack on America and health reform, for America's sake, she'd pick the terrorist attack. Yeah. Virginia Foxx offers living, breathing evidence of the effect of inefficacy on the Republican Party. When you don't really matter politically, you can afford to go nutso. But in terms of why we actually might not get health reform, the living, breathing evidence remains Senator Joe Lieberman of Connecticut.
The government going into the health insurance business, I think it's such a mistake that I would use the power I have as a single senator to stop a final vote for the American people.
But what you're also saying is that nothing is better than a government health insurance or a health insurance reform that includes a public option. Nothing is better than that.
Well, the truth is that nothing is better than that.
Senator Lieberman is threatening to make history by standing with Republicans to filibuster health reform. Democratic leverage to get him to not do that may depend on whether he's on his own or whether he persuades any other conservative Democrats to go along with him. So far, Senator Lieberman is on his own. We broke news on this show last week when Democratic Senator Evan Bayh told us that it is extraordinarily unlikely that he would join Senator Lieberman's filibuster. That leaves two other conservative Democratic senators as potential candidates to join Mr. Lieberman. They are Senator Blanche Lincoln of Arkansas and Senator Ben Nelson of Nebraska. Well, tonight we're going to make a little more news about the character of opposition to health reform. You may know that on Friday, a Research 2000 poll conducted for the Progressive Change Campaign Committee found that the people of Arkansas, Senator Lincoln's state, want the public option. And Senator Lincoln could face campaign troubles if she opposes the public option. Tonight, we can report exclusively that a new poll from the same group, along with Democracy for America, shows that standing with Joe Lieberman would also be a suicidal political move for Nebraska Senator Ben Nelson. Beltway common wisdom is that Senator Nelson might have to oppose health reform, and the public option specifically, in order to keep his constituents happy. Beltway common wisdom in this case is wrong. The new polling showing that Nebraska voters not only want the public option in health reform, it also shows that if Senator Nelson filibusters the public option, independents and Democrats in his state will be less likely to support him when he is up for re-election. And, this is the kicker, Nebraska voters think that Senator Nelson's reported $2 million in contributions from health and insurance interests hurt his judgment when it comes to his voting on health issues. Senator Evan Bayh isn't going with Senator Lieberman. Senator Blanche Lincoln's political self-interest is to not go with Senator Lieberman. Senator Ben Nelson's political self-interest is to not go with Senator Lieberman. Mr. Lieberman opened the door to killing health reform, and he invited other Democrats to come through. So far, it's lonely for him on the other side of that threshold. Joining us now is Ned Lamont. He ran as a Democrat against Joe Lieberman in 2006. He's also a fellow at the Harvard Institute of Politics. Mr. Lamont, thank you for joining us.
Hey, Rachel, it's nice to be here with you.
I have a feeling you're going to say, yeah, I told you so, but I still have to ask. Does it surprise you that Senator Lieberman would join Republicans to filibuster health reform?
It surprises me in this sense. Everybody thought that our race 3 years ago was just about the war in Iraq, whether it was a good idea to invade or not. But we spent an awful lot of time talking about health care reform. And during that race, I accused Senator Lieberman of dithering and after 20 years in the Senate not doing anything on fundamental health care reform. And he was the one that came back and said unilaterally, I support universal health insurance for all Americans and I'm going to fight for it. So I'm surprised that a few years later he is dithering again.
I know I went back and looked at some of the contemporaneous coverage from your race, and I know back in September 2006, during that fight, Senator Lieberman told reporters on a conference call, I have long supported the goal of universal health care. Ned Lamont can talk about it. I've been doing something about it all the time I've been here. If he does end up being the one guy who stops it, if it is his filibuster, what do you think the political costs will be of that?
Look, the people of Connecticut are ready to have a vote. They want to have a vote on fundamental health care reform, and they want the choice of a public option. Senator Chris Dodd, all of our congressionals are on board with that. And again, it's Senator Lieberman who's the outlier. So I think there will be political consequences if it's Senator Lieberman who's the one person who stands in the way, who obstructs our opportunity to have a fundamental vote on health care reform.
What do you think those consequences will be, though? One of the things that we have to think about is what happens in Washington, whether or not the Democrats in the Senate allow him to keep his chairmanship of the Homeland Security Committee. There's also the question of whether or not he faces political consequences at home. He seems to be planning to run again.
I believe I would know. I'd probably be the last guy in Connecticut to know whether he's going to run again. But I can tell you there's an awful lot of folks here who are looking forward to the opportunity of challenging Senator Lieberman. You know, during our race a few years ago, he said nobody wants to have a Democrat elected president as much as I do. He supported health care reform. Nobody wanted to get the troops home more than he did. 3 years is a long time. I think there are a fair number of folks, independents, moderates, Republicans, and Democrats, who are disappointed where the words aren't matching the action. And I think they're looking for a change.
Why do you think he doesn't just become a Republican?
I think he's been a Democrat for an awful long time, but I think tactically he's probably looking at his options right now. I got to believe when you walk away from health care reform, when you deny your fellow senators a right to vote on health care reform, that seems to be somebody who knows that he was elected in 2006 with overwhelming Republican support. And I think that's his base.
Ned Lamont, who ran as a Democrat against Joe Lieberman and beat him in the primary in 2006. Mr. Lamont, thanks very much for taking time to join us tonight.
Rachel, thanks for having me.
Appreciate it.